You know, so many of us have this morning ritual, right? You wake up, you step on that smart scale, and boom, it spits out this whole dashboard of data. Your weight, sure, but also your body fat percentage, muscle mass, the whole shebang. But here's the real question. How much of that can you actually believe? I mean, really take a second to think about it. Have you ever had that feeling where you look at the numbers and they just don't make any sense? They don't line up with the hard work you're putting in or how you actually feel. And this is exactly what I'm talking about. It can be so frustrating, right? The scale says you lost muscle, but you just crushed your personal best in the gym and you feel stronger than ever. Or it tells you your body fat went up, just as your favourite pair of jeans is starting to feel a little loose. It feels like a total contradiction. And that really gets to the core of the problem. Your scale is fantastic at giving you numbers. It gives you lots of them with decimal points and everything. But those numbers aren't the same thing as medical truth. These devices create this illusion of precision that can trick us into making some really bad decisions about our diet and our training. So if the daily numbers from our scale are kind of shaky, what should we be paying attention to? Well, let's just cut through all that noise for a minute and look at what health span clinicians, the real experts, actually focus on. It turns out they focus on three fundamental pillars that paint a much, much clearer picture of our long-term health. So first up is bone mineral density. And look, this isn't just about trying not to break a bone if you fall. It's way bigger than that. Your bone health is a powerful predictor of your independence and your quality of life as you get older. Think of it this way. Strong bones are literally the framework for a long, healthy, active life. Second, we have skeletal muscle mass. And honestly, this is so much more important than just aesthetics or looking good. Your muscle is your body's metabolic engine. It's what helps you manage blood sugar. It's what determines how quickly you can bounce back from an illness. And it's one of the absolute best predictors of longevity we have. And the third pillar, and this one is so critical, is visceral adipose tissue, or fat for short. Now, this is the really nasty stuff. It's the hidden fat that gets packed deep inside your abdomen, wrapped around your vital organs. You can't see it, you can't pinch it, but it's incredibly active. And it's a huge driver of chronic diseases like diabetes and heart disease, totally independent of what the scale said. So the obvious next question is, how on earth do we measure these three critical pillars accurately? Well, for that, we need to step away from the bathroom scale and into the world of medical imaging. These are the tools that give us the real story, the ground truth. And what's so great about this is how clear cut it is. It's about using the right tool for the right job, for bone density and getting a really solid look at your lean mass. A DEXA scan is the international gold standard, period. And for that dangerous visceral fat, a low-dose CT scan or an MRI is simply the most accurate, most reliable tool we have. Now, I know what some of you are probably thinking. Whoa, CT scan, isn't that a ton of radiation? And that is a totally fair question, but this chart puts it into perspective beautifully. A targeted low-dose V-scan gives you a radiation dose of about 1 millisievert. As you can see, that is less than half the radiation you naturally get just by living on planet Earth for a year. And it's significantly less than a standard mammogram, so it's really quite low. Okay, so now that we've established what the gold standards are, let's circle all the way back to our trusty smart scales. What are they actually doing under the hood, and why are the numbers they give us so often, well, all over the place? You've definitely seen claims like this one before, right? a smart scale company advertising 98% DEXA like accuracy. I mean, that sounds amazing. It sounds like you're getting a medical grade scan right in your own bathroom. But there's a huge catch. And that catch comes down to a tricky but super important concept: the difference between correlation and agreement. See, correlation just means that across a big group of people, the scale's results kind of sort a trend in the same direction as a DEXA scan. But agreement, and this is what really matters to you, agreement means the scale gives the right answer for you as an individual. And here's the crazy part: you can have super high correlation for a group, even if the scale is dead wrong for every single person in that group. They are not the same thing. So why are the results for you, the individual, so unreliable? Well, it's because the technology these scales use, called bioimpedance, is basically just sending a tiny, harmless electrical current through your body. And that current's path is massively influenced by how much water is in your system. So things like your hydration level, if you just worked out what you ate, your salt intake, even the time of day, they can all throw the numbers way off. All this stuff creates daily noise that we mistake for real changes in our muscle or fat. But hang on, this doesn't mean you should go and toss your smart scale in the trash. Not at all. It just means we need a smarter way to think about it. We need a framework, a tiered system that puts all this data in its proper context. And here it is. I want you to think of this like a pyramid at the very, very top, the peak of the pyramid. That's your medical truth. That's what you get from imaging, like a DEXA or a CT scan. That's for diagnosis. Now, in the middle, you've got your functional markers, real-world things you can track, like your waist measurement, glucose spikes, and how much you're lifting in the gym. And then at the very bottom, the wide base of the pyramid, that's your smart scale. Its job is all about engagement and just watching for broad long-term trends. And this right here, this totally reframes the purpose of body composition scales. Their real value isn't diagnostic at all. It's psychological. It's behavioural. Their power lies in getting you to step on every week, creating a routine, keeping you engaged with your goals, and driving the consistent habits that actually lead to change. They are a tool to keep you in the game, not to give you a medical report. All right, so let's tie this all together with some really clear, simple, actionable advice on how to use all this data the right way. Honestly, it just boils down to this really simple separation of duties. Use your home scales and your fitness trackers for motivation. Use them to help build good behaviours. But when it comes time to make actual medical decisions about your health, that's the job for precise medical imaging. It's all about using the right tool for the right job. And if you're looking for the most practical piece of advice, here it is. Please stop obsessing over the day-to-day jumps and dips in your scales, muscle and body fat numbers. It's mostly just noise. Instead, trust the real-world signals. Is your waist measurement slowly getting smaller? Are you getting stronger in your workouts? Those are your true North Stars. So if you remember just one single thing from all of this, let it be this simple mantra: track for trend, image for truth. Use your daily tools to track the general direction you're headed, but rely on medical imaging when you need to know the absolute truth of where you stand. So I'll leave you with this question to think about. Now that you understand the difference between that illusion of precision from your scale and the actual medical truth, how is that going to change the way you look at and use your own health data from now on?